Hello, and welcome to the presentation of Understanding Trauma. My name is Karyna Sitkowski, and I am a developmental psychologist. I received my undergraduate psychology degree at Wayne State University, and I earned my master's in developmental psychology at Maastricht University in the Netherlands. My developmental degree was both medical and research focused. My specialty is understanding trauma and the impact it has later in life. So before we start the presentation, I'd like to make it very clear that trauma affects everybody differently. 100 people could have the exact same traumatic event and everyone will react differently. So when you learn about this, just keep that in mind. So first of all, what is trauma? Trauma is something that a person was exposed to, such as death, threatened death, actual or threatened serious injury, or actual or threatened violence, and more. Some examples include and are not limited to bullying, community violence, natural disasters, domestic violence, medical trauma, physical abuse, sexual abuse, and terrorism. Trauma can be experienced in many different ways, such as direct exposure, witnessing the trauma, learning that a relative or close friend was exposed to a traumatic event, indirect exposure to details of the trauma, usually in the course of professional duties such as first responders or medics. So trauma can be either implicit or explicit. So what does that mean? Explicit trauma is a traumatic event that you can remember or recall, while implicit trauma is trauma that is not remembered. Our ability to remember begins around the age of 3. If a child does not remember this trauma, it is embedded within the body's memory. This later can result in physical reactions or flashbacks to certain events or situations that a person may not be aware of. And that can be very difficult. If you don't remember the trauma, you're very confused on why you may react certain ways. And that can be very difficult, right? Because you can't fix something you don't know that happened. So this is a very important part of trauma. People who experience trauma are constantly stuck in the past. Their life revolves around this past event. Life becomes divided between people who have experienced trauma versus those who have not. Trauma can also be present itself with symptoms of other mental illness. Trauma can be the root cause of a problem, while other mental issues can sprout from it. I like to think of it as a tree, so imagine the roots of a tree being trauma, and the tree growing up, we can have depression, anxiety, obsessive compulsive disorder, and many other things. So what are the outcomes of trauma? Our body and mind's main focus is survival. Our main way of surviving is through an internal instinct that we call fight or flight mode. For example, if you see a tiger, your natural instinct would either be to run away from the tiger or fight the tiger. People with significant trauma experience fight or flight mode when triggered by a specific event, a situation, or even a conversation regarding a traumatic event. This reaction is a protection mechanism from potential dangers or triggers. And again, these are individual to each person develop specifically on their past. We can also have overwhelming emotions, the masking of feeling of shame and protection from ourselves, ultimately. However, if a person experiences extreme amount of prolonged fight mode, they can actually do significant damage to their body and brain. So your mind and self with trauma. When a person is triggered, the body reacts along with the brain. Mental health and physical health are a two-way street. The brain sends signals that the individual is not safe, which in turn results in the body defending itself. Every part of the body is experiencing severe distress. When this is prolonged, again, it can do permanent damage to the body and even kill brain cells and other brain matter that we can see through neuroimaging, such as gray matter. The effects of trauma on the mind play a very large part in our everyday functioning. Individuals become numb and distant from their feelings. The brain can feel so overwhelmed from these intense feelings, it can disconnect the person from their feelings and reality completely. When you can't fully be present with your body and mind, you go to places that you once felt alive. And unfortunately, that could even be that traumatic event. So here we have a picture. It might be a little hard to see, so I'm going to use my cursor here to point a little bit. So it says trauma affects the entire human organism, so body, mind, and brain. The body continues to defend against a threat that belongs in the past. Healing from trauma means being able to terminate this continued stress mobilization and restore the entire organism to safety. So as we can see, here's a picture of our brain. I'm not going to go into super detailed neurobiology here, but as we can see, we have all these arrows coming from our brain. So here we have our facial muscles reacting, our heart and lungs, right? So when we're activated, our heart may beat faster. It might be hard to breathe. We have the GI tract. So sometimes it's slowing down, sometimes it's speeding up, right? So you could have constipation, diarrhea, or just general stomach pain. And of course, we have the adrenal glands, which release stress hormones. So as you can see, it has an overall toll on so many parts of the body, organs, your brain, hormones, all of these things can be affected. So we are focusing on children in foster care and adopted children. And so I'd like to kind of focus on the developmental of teens. So this is from the age of 15 to 17 years old, and this information is from the CDC. And I'm going to explain the impact of trauma that has on this age group. So every age group develops new skills. So our social skills, emotional skills, cognitive skills, they develop through the majority of our lifetime. Our personality and opinions become more developed at that age. Our understanding of ourself starts to develop a bit more. And our ability to explain and express life choices, including what is right and wrong. Teenagers around this age, they show more independence from parental figures. They develop deeper capacity for developing more in-depth relationships. And of course, sadness and depression can develop easier during this age. These behaviors are often a cry for help. Effects of trauma on teenage development. So all those things we just learned on the previous slide are impacted. Many people can misinterpret the symptoms of trauma and just assume they're bad kids or dealing with common teenage issues. It's often natural for youth this age to become more withdrawn and make impulsive decisions. However, these are also signs of trauma. Traumatized individuals hold dangerous emotions inside, which only continue to promote serious behavior, loneliness, confusion. Youth with trauma often don't feel that they're being noticed or being seen because of their isolated traumatic event. They often feel shame or guilt that makes it harder to talk to people about this issue. And this can cause kids to develop self-harm behaviors, more risky behaviors, or even participate in illegal actions. These behaviors are often a cry for help. And again, trauma affects the process of basic development within youth. So there are very large impacts that can be life-lasting. But probably thinking this is all maybe depressing, or you can't overcome trauma. It's not a permanent thing, and you can heal from that. So, what options do you have to heal from trauma? What can you do? The experience of the traumatic event will never go away. However, symptoms and difficulties that come with trauma can be overcome. So, trauma is something that can be conquered and completely manageable. One of the best ways to process trauma is through trauma-informed therapy. So, working with someone with extensive knowledge about trauma can guide you safely when navigating these difficult issues. So, a great resource to find a therapist is Psychology Today, and you can look through all these therapists and look for those who are trauma-informed. If you can't find a therapist who is trauma-informed, there are many other therapists that can assist with wonderful education. But however, if you can find a trained individual with more education in trauma, that would be preferable. Support groups can also be a good option to get input and support from others with similar life experiences or feelings. If needed, psychiatrists can help prescribe medication. Medication does not cure trauma, and it doesn't correct behavior, but it does help reduce difficult symptoms such as anxiety and depression that can come with trauma. So it's important to please see a qualified psychiatrist for psychological medication and not your primary care physician. Most primary care physicians do not have education in psychiatric medications. So it's very important that you see someone who is specialized, because those medications, as you can imagine, are very delicate. So that is very important that you see a psychiatrist. You can't see your doctor and ask about those options, or your psychologist, and then you can find someone going forward. But definitely get an opinion from a medical professional before you see a psychiatrist to make sure that's the right fit for you. Yoga is a main treatment that combines movement for the body and utilizes deep breathing techniques that can connect both symptoms of mind and body. Most people are pretty surprised that yoga can have such an impact, but it has been proven scientifically to help reduce symptoms experienced from traumatic events, and it's often used with veterans with severe trauma with wonderful results. There are yoga classes for all ages, for all different levels, and they're available and often very affordable. So definitely check out some local yoga studios around you. A lot of charities will put on yoga events, so keep an eye on those, especially in the spring and summertime. They're wonderful sessions outside, which is even better to have that fresh air. Another tool, writing can be a good tool to help release thoughts, emotions, as well as even some conscious thoughts. Writing is a therapeutic process that allows a steady flow of expressing emotions without judgment from others. Music, dance, theater, and other forms of creative outlets can also be a way of releasing emotions that lead to healing. Anything creative is a wonderful outlet, so just keep that in mind. What can your life look like after healing? So trauma can be overcome and less impactful on the individual. Healing allows us to move forward. That past traumatic event holds us back. It holds us back from experiencing new things. Releasing that grip of trauma can allow us to move forward in many different ways of our life, which can ultimately lead to a healthier and happier life. You'll start to have less triggers or activation. Those body sensations will also go down. Trauma does not overpower existence. It is not something that you have to deal with for your entire life. It is something, again, that can be overcome and doesn't define you as a person. It also, healing gives us an explanation to our thoughts and behaviors, perhaps when we were activated or triggered, right? Sometimes people may act erratically or very defensively, and a lot of times that's our way of our body defending itself. And sometimes we can feel shame or guilt about those actions, but It's important to understand our reactions and our body's defense, and it can explain those things and help us move forward and be able to forgive ourselves for those things and improve those actions going forward so they don't happen. It helps our ability to understand ourselves. It helps us understand our wants, our needs, our dreams. Trauma has a very big impact on imagination. So it's very hard to imagine yourself getting that new job or moving forward and having a relationship. And ultimately, it's important to know that understanding that you are not your illness, you are not your trauma. You are a person with personality. You have your likes and dislikes. You have friends and family. There is so much more about you than that traumatic event, and so much more than your mental health issues. So it's important to put ourselves first, not our illness. So this slide has some mental health helplines. As we can see, we have NAMI, which is the National Alliance on Mental Illness. We have the hours here. You can call them, you can email them with questions, you can text and chat with them if you're experiencing some type of distress or you just need someone to talk to. 988 is a new number for the Suicide and Crisis Lifeline. It was put through law that we actually changed the number, so it's kind of like a 911 situation, right? It's to remember easily to remember that number in case you have crisis. Before, it had just kind of a normal phone number, and they wanted to make that a lot easier for people to call in. So if you do have that number, still the old number, maybe on a flyer or a magnet or whatever resource you may have, you can still use that number. So, however, it's just easier to remember 988. So both lines can be used in crisis situations, suicide prevention, assistance in finding local support, and for those concerned about mental health of a loved one. So even if you have basic mental health questions, you can talk to these lines and they will help you find options or find help for friends or family, help for yourself. Again, find local support. They're there to support you in more than just a crisis situation. Again, all lifelines and online chats are completely free of charge. The 988 Suicide and Crisis Lifeline can assist individuals with neurodivergence, veterans, Black mental health, maternal mental health, help youth, disaster survivors, Native Americans and Alaskan Natives, loss survivors, LGBTQ, attempt survivors, deaf or hard of hearing and hearing loss. On their website, they do have a helpline for people who are maybe deaf or hard of hearing. So you can actually go on their website and find options for that. And they also have the line in Spanish. Many people don't know that the Crisis Lifeline can help you find a translator for tons of different languages. So it's not just available in English and Spanish. If you speak a different language, you can talk to them and they will connect you with someone who can help and translate. Here's some additional mental health lines. So we have the National Domestic Violence Hotline, the National Sexual Assault Hotline, and the Trevor Project, which is a hotline for LGBTQ plus youth. Again, these are available 24/7, translate in different languages, are available for call, text, chat. So you can Google these and find even more information. If you or someone you know is having thoughts of suicide or experiencing a mental health crisis, please get connected to a trained crisis counselor. Crisis counselors on these hotlines will listen to you empathetically and without judgment. Your crisis counselor will work to ensure that you feel safe and help identify options and information about mental health services in your area. So definitely use these resources and make sure you give them to friends and family, because you never know who's struggling in their life, and these could ultimately save someone's life. So to finish off, I really love this quote by Elizabeth Kubler-Ross. It says, "The most beautiful people we have known are those who have known defeat, known suffering, known struggle, known loss, and have found their way out of the depths. These persons have an appreciation, a sensitivity, and an understanding of life that fills them with compassion, gentleness, and a deep, loving concern. Beautiful people do not just happen." So if you're wondering where you can get more information, here are some resources. You can check the Veterans Affairs website. You can check the CDC. The majority of this information was from the book, The Body Keeps the Score. It is a wonderful book. All of this information is in that book. So if you're interested in anything mentioned in this presentation, definitely check that website out. So I'd like to thank everyone for watching this video. I hope you learned something. You can pass this information along to friends and family. Please feel free to share this video, social media, again, friends, family, whoever you want. You never know who could use this information that could really help some people out. If you have any questions, need resources, or any further information, please do not hesitate to email me at Karyna Sitkowski at JudsonCenter.org. That is KARYNA_SITKOWSKI at JudsonCenter.org. Again, I thank you for watching this presentation, and I hope you enjoyed it.